Hello everyone, my name is Dr. Tamisha Denis of Modern Smile and Implant Center, and today we're going to talk about the top 5 reasons that you may need a dental implant. Reason number 1. The first most common reason that we choose to do a dental implant, or you may need a dental implant, is the tooth is no longer savable. I talk a lot about in my other videos about dental heroics. We're talking about a circumstance where you have had a tooth in particular treated over and over, and there really is no saving it. So let's say, for example, you had a root canal and it was fine for a while, but now it just doesn't feel quite right. Now, usually when you have a root canal that doesn't feel quite right, remember, you shouldn't feel anything in a tooth that had a root canal. A lot of times that's a crack, and cracks cannot be fixed. That's one of those things we call in dentistry a non-restorable tooth, meaning you can't fix it. So if you've had a root canal and now it's starting to hurt for whatever reason, it might be hurting with hot, cold, sweet, or bite, or maybe just on an occasion it gives you a throb, that tooth may not be savable anymore. Now that is something that we can discuss whether or not the tooth is savable anymore, but a root canal is one of them. Another reason is sometimes we recommend a filling or a root canal and the cavity just gets so big, it overruns the tooth to the point that there's not much tooth left to begin with. In that case, having the tooth trying to patch together and filled, even if it is doable, will not last very long. And that's another reason that we'll choose a tooth that's non-restorable. In dentistry, we call it gross decay, and it really is gross because that means the cavity is pretty much overrun the whole tooth, and there's really not much tooth to save. That is another reason that you may need a dental implant. Reason number 2, your teeth are shifting. Now, I try to prevent getting your teeth shifting by telling you immediately when you have a tooth taken out, or if I see that you've had a tooth missing for quite a while, that it is important to replace. Now, most of the time when you have a tooth that is taken out or is missing between 2 teeth, what happens is the tooth in front of it will start to lean back, the tooth behind it will start to lean forward, and the tooth above it will start to move down simply because of gravity. Now, if you had a tooth there would be no reason for those movements to happen. But when you have a tooth missing in between other teeth, lots of shifting takes place. Now, some people I've seen within a year or a couple of months, the shifting happens right away. And some people I'll see that it'll take many years, but most times it will happen. And the only way to prevent your teeth from shifting is to keep all of the partners of the teeth there so they all work together. So if you have a tooth in that middle between those missing teeth, then you can keep your teeth from shifting all over the place. And that's so important because even though that's only one tooth missing, what oftentimes happens is other problems develop because that tooth is no longer there. So lots of times people say, well, Dr. Denis, it doesn't bother me having that tooth missing, but what they don't understand is in the future you risk the 3 other teeth that interact with those teeth, things happening to them. For example, that tooth in the front that's leaning back, things will start to get caught in that little corner, and you are more likely to get a cavity. And the tooth behind, it will also lean. In addition to the tooth that may be behind there, things get caught in front, things get caught underneath, and that also causes you to get a cavity. Now, if you can imagine, now a tooth is laying down, which should be standing up. Now that tooth is getting hit by that top tooth in a way that's not natural, causing that tooth to go a lot faster. In addition, the tooth above, same thing, things are coming down, and in addition to things coming down, things get trapped in between areas that wouldn't normally have food trap areas. So again, just because that one tooth is missing and it doesn't bother you, you are risking the longevity of the teeth surrounding. And imagine one of those teeth goes, then the next thing has to go. Another thing about tooth shifting is that once the teeth have shifted, if we place a tooth in the middle, they don't stand right back up. So that means you would either have to get braces, or we might have to resolve and pull another tooth because that tooth is not there. So again, a whole cascade of events happens once you're missing a tooth in between other teeth. And in order to prevent that, the dental implant there will maintain as if you have never lost a tooth. Reason number 3 that you may need a dental implant. Now, I always say teeth are meant for chewing. What is the point if you can't chew? What is the point if you can't enjoy your meals? I meet people all the time that say they only chew on one side. Why are you only chewing on one side? And that's because you have teeth missing or bothering you on the other side. Now let's talk about that. So if you don't have any teeth on one side, or maybe you just have one lone molar all by itself on that side, and therefore you chew on that other side, what happens is the side that you are chewing on all the time is doing all the work. And if the side you're chewing on all the time is doing all the work, guess what's going to go next? Those teeth, because the mouth is meant to eat in balance. It's meant to eat on both sides. If you're only chewing on one side, that side is going to go bad faster because it's not sharing the load. It's not sharing the work. So not being able to eat on one side, you may have gotten used to it, but the reality is if you don't take care of that, eventually the good side is going to go bad. Also, I also find that to be true when people don't have any molars in the back and all they do is chewing on the front. If you're doing only chewing on the front, what's going to happen is those poor teeth who are not meant for chewing biologically are going to go bad. So think about it. The teeth are shaped differently because of their different functions. The teeth in the front, they do the initial bite and you throw the food to the back, and then the teeth in the back, they mash the food up. So imagine if you're doing all the chewing on the front, those poor teeth start doing work they're not meant to do, and they will eventually break down. So that's why it's so important to have dental implants in the areas of the teeth where you don't have teeth, so that you can share the load equally, and that will feel just like any other teeth because they work just like any other teeth. Unlike partials, that even though you have teeth in the back, it doesn't really feel like you're doing a lot of chewing there. So some people, they'll have partials, but they'll still only chew on the side that they have their natural teeth. So teeth are meant for chewing. Imagine having a leg that doesn't work, an arm that doesn't work. It doesn't make any sense. You can't do all the work with only your right side or only your left side, because that poor side is doing all the work that is meant for both right and left. Reason number 4 that most people need dental implants. Reason number 4, you wear a partial, you wear a denture, and you don't like it. There is no point in living your life with something that you do not like. Something removable, it makes you feel aged, it makes you feel uncomfortable. You have to be conscious when you're eating out with other people, when you're speaking out with other people, because you have this thing that has to come on and off. So one of the reasons that we'll place dental implants is to get rid of that thing. You don't want it anymore, and the only way to get rid of it is to replace it. So let's say, for example, you're wearing a partial, you have a couple teeth here on the partial, a couple teeth there on the partial. If you have dental implants, you no longer have to wear that partial. Then it will also feel as if you're chewing with the natural teeth that God gave you. Imagine again that you have a denture and you don't want to deal with that thing anymore. You can throw it away. We place dental implants. We give you teeth all the way across the top or the bottom of your mouth. That means no pink acrylic portions to deal with, nothing that sits in this area under your nose. All of it is gone. You can speak, eat comfortably with your family and friends without being self-conscious. So that is what dental implants can do. It can get rid of any removable implants you have, whether that is a partial denture or if that's a full denture. Reason number 5 that people need dental implants. Reason number 5 is very important to me, and I think most women. And that reason is you're missing teeth in your smile line. So if you smile nice and broad and something's missing right about here or something's missing right about there, you want to be able to smile with confidence, knowing that nobody's pointing that thing out in your mouth. It's so important to be able to have that confidence when it comes to smiling broadly. I mean, it's also healthy for you replacing those missing teeth. Like the other reason I said, being able to chew comfortably on both sides. But there's nothing like feeling good about your smile. And if that is because you have a tooth missing and you're self-conscious when you laugh, I always say when you laugh, ha ha ha, and you open your mouth really big, if you see that missing tooth down there, or if you try to smile a certain way because you're missing that tooth right there. I think, when I meet someone and I see how they speak, I see how they interact even with me as a dentist, I can tell if they have modified their mouths and their behaviors in order to cover things up. And some people that will smile with their mouth closed, and it looks very disingenuous. And the reason they're doing that is not because they don't have a genuine smile, it's because they're hiding something. And if you are hiding something and you'd like to smile with confidence, or you like to be jovial and laugh, and you want to fill in your smile, a dental implant can be the answer for you. So let's do a quick recap of the top 5 reasons that you may need a dental implant. Reason number 1, the tooth is not savable. You've had a root canal already and it's just not going to work the second time around. Or the cavity has gotten so large, there's not any tooth left to fix. So that's reason number 1. Reason number 2, to keep your teeth from shifting, or if your teeth are already shifting. So remember, if you have a tooth in the place of that missing tooth, an implant in the place of that missing tooth, all your teeth won't start to try to overcompensate and lean into those missing areas. Reason number 3, you only chew on one side. Teeth are meant for chewing, and if you only chew on one side, you're going to cause that one side to start going bad, and now you'll have no good side to chew on. Reason number 4, you don't want to wear a removable appliance anymore. You don't want a denture, you don't want a partial, you want to throw it away, replace them with implants, and you'll chew as if you always had teeth. Reason number 5, you're missing teeth in your smile line. You want to smile with confidence. You don't want to be self-conscious of any gaps or spaces in your smile. You want to smile from ear to ear with no problem. So those are the top 5 reasons that most people need dental implants. If you think any of those reasons apply to you and you want to visit us in our office, we do offer a free consultation. We'd love to meet you.